Have you ever come across someone who is constantly seeking attention or is particularly extroverted or flirtatious, just over the top really? Well, it might well be that they are not just a simple attention seeker or a flirt, but they may actually have a clinical illness called Histrionic Personality Disorder or HPD. Yes, they may actually be a certified psychiatric nutjob. Not many people know about this diagnosis, even many fellow doctors that I speak to, but it is a definitive illness, as mentioned in the Psychiatric Diagnostic Manual DSM5, the most authoritative diagnostic manual in the world. So let's arm you with the knowledge to spot someone who may have HPD, Histrionic Personality Disorder. Hi, welcome back to the channel. My name is Dr Aziz. I'm a psychology graduate of Cambridge University and also a medical doctor. In general, HPD or Histrionic Personality Disorder is described as a personality disorder characterized by a pattern of excessive attention-seeking behaviors, usually beginning in early childhood, including inappropriate seduction and an excessive desire for approval. People diagnosed with the disorder are said to be lively, dramatic, enthusiastic, extroverted, and flirtatious. Basically a complete attention seeker. Yeah, we all know at least one of them. So as mentioned earlier, the DSM-5 is the most recognized diagnostic manual in the field of psychiatry worldwide. It defines histrionic personality disorder as a pervasive pattern of excessive emotionality and attention seeking, beginning by early adulthood and present in a variety of contexts, as indicated by 5 or more of the following. The person is uncomfortable in situations in which he or she is not the center of attention. Interaction with others is often characterized by inappropriate, sexually seductive or provocative behavior, displays rapidly shifting and shallow expressions of emotions, consistently uses physical appearance to draw attention to self, has a style of speech that is expressively impressionistic and lacking in detail, shows self-dramatization, theatricality, and exaggerated expression of emotion, is suggestible, i.e. influenced by others or circumstances, and considers relationships to be more intimate than they actually are. Now, as mentioned, HPD is described as a personality disorder, and as such, as well as the above specific criteria, an individual must also meet the general criteria for personality disorder. These include an enduring pattern of inner experience and behavior that deviates markedly from the expectations of the individual's culture. This pattern is manifested in 2 or more of the following areas: cognition, i.e. ways of perceiving and interpreting self, other people and events; affectivity, i.e. the range, intensity, lability and appropriateness of emotional response; interpersonal functioning; and impulse control. The enduring pattern is inflexible and pervasive across a broad range of personal and social situations, so affects multiple areas of their lives. The enduring pattern leads to clinically significant distress or impairment in social, occupational, or other important areas of functioning. The pattern is stable and of long duration, and its onset can be traced back to at least to adolescence or early adulthood. The enduring pattern is not better explained as a manifestation or consequence of another mental disorder. The enduring pattern is not attributable to the physiological effects of a substance, i.e. a drug or another medical condition. Managing histrionic personality disorder. So what are treatment or management options for someone with HPD? In most cases, people with HPD do not believe their behaviors are problematic. They also tend to exaggerate their feelings and dislike routine, which make following a treatment plan difficult. However, they might seek help if depression, possibly associated with a loss or failed relationship, or another problem caused by their thinking and behavior causes them distress. Psychotherapy, talking therapy, is generally the treatment of choice for histrionic or other personality disorders. The goal of treatment is to help the person uncover the motivations and fears associated with their thoughts and behaviors, and to help the person learn to relate to others more positively. Types of psychotherapy that may benefit people with histrionic personality disorder includes group therapy. This is a type of therapy in which a group of people meet to describe and discuss their problems together under the supervision of a therapist or psychologist. Group therapy may be of particular benefit to people with HPD, especially if it's with other people with HPD. It can help someone with HPD see their own behavior reflected back at them. Psychodynamic psychotherapy. This type of therapy focuses on the psychological roots of emotional suffering. Through self-reflection and self-examination, the person undergoes therapy, looks into problematic relationship patterns in their lives. Supportive psychotherapy. This type of therapy aims to improve symptoms and maintain, restore, or improve self-esteem and coping skills. Supportive psychotherapy involves the examination of relationships and patterns of emotional response or behavior. And cognitive behavioral therapy. This is a structured, goal-oriented type of therapy. A therapist or psychologist helps you take a close look at your thoughts and emotions. You'll come to understand how your thoughts affect your actions. Through CBT, you can unlearn patterns of negative thoughts and behaviors and learn to adopt healthier thinking patterns and habits. While there's currently no medications that can treat personality disorders, there is medication for depression and anxiety, which people with histrionic personality disorder may also have. Treating these conditions can make it easier to treat histrionic personality disorder. Anyway, what are your thoughts? Have you met anyone exhibit these kind of behaviors or symptoms? What has your experience been like? Do post below. I hope you learned something useful and enjoyed this summary. If you want to keep learning about psychology, medicine, or life hacks, hit the like, subscribe, and notifications button. Any suggestions or comments, feel free to to post down below. Until next time, stay safe.